Camaraderie Health Agency presents Medicare Advantage. Camaraderie Health Agency is not connected with or endorsed by U.S. government, federal Medicare program, Social Security, or any other government agency.
Medicare Part C and D, Medicare Advantage prescription drug plans. Part C, this is called Medicare Advantage. You can buy Part C from a private insurance company. Medicare Advantage combines Part A and Part B, and sometimes all prescription drug coverage. It can include additional benefits like dental, eye care, hearing, or wellness services. You can buy a Medicare Advantage plan, Part C, if you are enrolled in Part A and B, live in the plan service area. Part D, prescription drugs. It helps pays for prescription drugs. It's only offered through private insurance company. We'll talk more about Part D later. When you choose a Medicare Advantage Part C, the plan will cover Medicare Part A and B, all the same benefits as original Medicare, and may include benefits original Medicare doesn't cover, like dental, hearing, and vision care. Prescription drug care Part D with most plans. Part C also has a yearly limit on out-of-pocket costs for covered medical services, unlike original Medicare. So what's the bottom line? Part C or Medicare Advantage combines Part A and Part B benefits, usually Part D in one plan. There are plenty of options. We can help you weigh them. Your option, how to choose your plan. Questions to consider. What monthly plan premium can I afford? Does the plan cover the service I need? Can I see the doctors I want? What about prescription drug plan? It helps to pay for prescription drugs. It only offered through private insurance company. You can choose from two paths. One, original Medicare, Part A hospital, Part B medical, Part D a separate drug plan if you buy it, supplemental insurance if you buy it. Or the second choice is Medicare Advantage. Combine Part A hospital and Part B medical. Both plans include prescription drug plan. Medicare Part D, if your plan doesn't include it, you may be able to join a separate Part D plan. If you choose Medicare Advantage, here are the two options. One, a health maintenance organization, HMO. You'll use doctors in the network. You might need a referral to see a specialist. Second choice is a preferred provider organization, a PPO. You can use doctors and hospitals outside of the network, but often for a higher share of the cost.
If you choose Medicare Advantage, here are other options. A private fee-for-service plan, a PFFS plan aren't the same as original Medicare or Medigap. The plan determines how much it will pay doctors, other healthcare providers, and hospitals, and how much you must pay when you get care. The other option is a medical saving account, MSA plan. The Medicare Advantage plan, called a Medicare MSA plan. These plans are similar to a health saving account plan available outside of Medicare. You can choose your health care service providers. MSA plans usually do not have networks of doctors or other healthcare providers or hospitals. A prescription drugs may be covered in a PFFS and MSA plans. If your PFS and MSA plan doesn't offer drug coverage, you can join a separate Medicare drug plan, Part D, to get coverage.
Medicare Advantage may include dental, annual hearing exams, eyewear and hearing aids, Part D prescription drugs, emergency Medicare outside the U.S., out-of-pocket medical costs, annual limit. D-SNP, dual eligible special need plans. What is D-SNP? D-SNP stands for dual eligible special need plans. D-SNPs are specialized Medicare Advantage plans created for those who qualify for both Medicare and Medicaid. You must have a state Medicaid plan and qualify for a Medicare Advantage plan to be able to get a D-SNP. How do D-SNPs work? With a D-SNP, Medicare is a primary payer for medical services, while Medicaid is a secondary payer. This means that Medicare is the first to pay for covered medical services. The Medicaid pays for the most remaining qualified costs. Some members will have remaining out-of-pocket costs. Why should you consider a D-SNP? Much like a traditional Medicare Advantage plan, a D-SNP can include extra benefits that original Medicare and Medicaid alone may not cover. This includes dental care, ISM, transportation to the doctor appointment, and more.
Medicare Advantage Part D. What you need to know about prescription drug coverage. Prescription drug coverage has 4 stages of cost. Stage 1, deductible. Until you have reached your deductible, you will pay the full discounted cost for your covered drug. Some plans have a 0 deductible. Stage 2, called initial coverage. After you have reached your deductible, you will pay only part of your cost for your covered drugs. Stage 3, called the coverage gap. After you and your plan have paid the total initial coverage limit, you will pay only part of the cost for your covered drug until you reach the coverage gap limit. Stage 4, catastrophic coverage. Once you have paid the coverage gap limit, you are out of your coverage gap, then you will pay either copay or quotient, whichever is higher.
Bringing it all together. Step 1. Enroll in Medicare Part A and Part B when you're first eligible. Now you have 2 ways to proceed. 1, keep original Medicare and add a Medicare supplement insurance and Medicare Part D. 2, buy a Medicare Advantage plan. This could buy a Medicare Part A and Part B and also Part D and additional benefits.
Camaraderie Health Agency. This is an education Medicare video to help you understand your Medicare Advantage plans and your options for further help. Contact Camaraderie Health. For a free consultation, call 224-433-5754 or go to www.camaraderiehealthagency.com. Subscribe to our YouTube channel. Like us on Facebook, Instagram, LinkedIn, and Twitter.